10:45 on my clock, so let's go ahead and get started with our next session. My name is Denise Dias. I'm a member of the Age Positive Planning Committee and also a staff member at K-State Research and Extension, Johnson County. Before I introduce our workshop panel, there's a couple of reminders for those of you that may have just joined in today. All of our participants are muted during the presentation. We ask that you keep your cameras off because that helps with the overall connectivity of the conference. Please be sure to enter your questions for the presenters in the chat. I will keep track of those questions and relay those to the panel when it is appropriate. Also, please use the chat to enter any comments. It's important that we share and that we learn from each other. That's what's so good about having a session like this. The presentation will be recorded. The recording and PowerPoint presentation will be made available within 2 weeks following the conference. You'll receive an email announcement when these are available on our conference website. At this time, I would like to introduce Tane Lewis. She is the Evidence-Based Program Coordinator with Mid-America Regional Council's Aging and Adult Services. She's going to serve as our panel moderator today. And then a quick shout out to our panelists. We have Kathy Armitage from the YMCA in Platte County Community Center South. We have Kim Downs. She is with the Kansas City Quality Improvement Consortium. And Victoria Jackson. She is with Liberty Parks and Rec. One of our panel members, Orvie Prewitt, who is not able to join us today due to a death in her family. She is with the KC Regional Arthritis Center and also contributed a lot to our presentation today. So without further ado, I will turn it over to Tane.
Okay. Hope everybody can see everything okay. I think I have control. Thank you, Denise. Before we get started, I just want to mention that Denise happens to be a fantastic facilitator of evidence-based programs, and I truly value her talent, investment, and enthusiasm. I also want to thank each of you for attending our session today. We appreciate that you're interested in learning more about this topic and hope that you find the information that we're about to present to you worthwhile. Our purpose here today is to explain the benefits of evidence-based programs and the research that proves their efficacy, explain how many evidence-based programs are funded in the metropolitan region, and share some of our best practices related to collaboration, marketing, participant recruitment, as well as tips for overcoming common barriers. Before we get started though, we'd like to learn a little bit about you. We have a few poll questions that we're going to post now that will help guide our discussion. So you can see the questions there. Number one, are you or your organization familiar with evidence-based programs? Number two, are you or your organization currently offering one or more evidence-based programs? And three, are you or your organization considering implementing evidence-based programs in 2021? So I'm going to give you guys a couple more seconds. You're fast. Everything's moving quickly, I can see. Well, that's really good to see that most of you at least are familiar with evidence-based programs. And now we should be back here. I'm gonna go ahead and just get started while if you can finish writing in if you want. So thank you for your responses. We really appreciate it. So I want to begin with a brief overview of the challenge facing our communities and why facilitating evidence-based programs is one tool in our toolbox to meet the challenge. So the challenge is a changing healthcare environment. We're seeing a lot of growth in the number of older adults in America, for one, and at the same time, we're seeing shifts to value-based care. That shift includes a focus on addressing social determinants, which require stakeholders to look beyond the walls of the clinical setting and address the barriers to healthcare that exist in communities and our social milieus. In addition, chronic disease significantly impacts Missourians. Data suggests that 95% of Missourians age 65 and older had one of 13 chronic diseases. More than 80% had at least two, and 65% had at least three. And nearly 7 of every 10 Missourians who die each year die of a chronic disease. And lastly, sadly, Missouri ranks 44th out of the 50 states for hospital readmissions among Medicare enrollees. So why use evidence-based programs to address these challenges? Chronic diseases and falls are now the leading causes of death and disability among older adults in America, but both are preventable. Evidence-based programs have been proven to be effective tools to improve participants' health literacy, increase their healthy habits, decrease their risk of falling, and improve their overall health and well-being. So what are evidence-based programs and why do they work? Evidence-based programs in the context that we're talking about today are disease prevention and health promotion programs that have been proven to reduce the need for more costly medical intervention and improve the lives of those who participate. As you can see from this slide, to qualify as an evidence-based program, these workshops must undergo rigorous review and prove effectiveness. Evidence-based programs are also packaged for use as replicable, community-based workshops. Facilitators of the programs receive specialized training, support materials such as implementation manuals, books, and CDs. And as a result, the program's content and fidelity is consistent across all settings. Secondly, it's the law. States that receive Older Americans Act funds under Title III are now required to spend those funds on evidence-based programs to improve health and well-being and reduce disease and injury in our communities. Title III funds used for this purpose are broken into two sources. We have Title IIID and Title IIIE. Title IIID funds can be allocated for evidence-based programs that serve adults 60 years of age or above, and Title IIIE funds can be allocated for evidence-based programs that serve caregivers if they aid an adult who is 60 years of age or above, and if they are a grandparent caring for a grandchild, or if they are a parent caring for a disabled adult. So how can you and your organization access Title III funds to support your programs? Each state in the country allocates Title III funds to area agencies on aging for this work. And these AAAs frequently collaborate with community-based organizations to deliver these programs in their regions. So it's always a good idea to contact your AAA to determine if they will consider supporting your programs. Looking a little more closely at the benefits that evidence-based programs provide to older adults in particular, studies show that participants reported that they had better health, had more energy and less fatigue, were exercising more, had fewer social role limitations, so they were able to do the things that they enjoy and wanted to participate in. They have better psychological well-being, and they report having better partnerships with their physicians, which is a really big deal. So we all like hearing success stories, right? I'd like to share one to demonstrate the impact of evidence-based programs. And this is the story of Pam, a woman in her 60s who attended 3 different self-management workshops in a row. And Kim, one of our panelists that you'll meet soon, and I first met Pam when she participated in a chronic disease self-management program. So when we first met her, she was overweight, diabetic, had high blood pressure and kidney disease. She arrived at our first session in a wheelchair due to severe leg pain and neuropathy in her feet. She was also taking several medications to manage her different chronic health conditions. By the end of the first workshop, Pam was invested in and totally enthusiastic about managing her own healthcare. She then came to another workshop that we hosted at the facility that she stayed at, and she attended. It was called Healthy Hearts, and her blood pressure, weight, blood oxygen level, and her BMI was measured every week. And by week 6 of the Healthy Hearts workshop, she had lost 12 pounds. Her blood pressure was within the normal range. And a month later, she enrolled in a diabetes self-management program, and she simply waltzed in with the aid of a walker, smiling ear to ear, and reported that she had lost another 15 pounds. By the end of that workshop, her A1C was down to 7. Her doctor had taken her off of insulin, and she was just taking an oral dose of metformin, and otherwise was managing her blood glucose levels with diet and exercise. What an accomplishment over a relatively short amount of time. Not only are evidence-based programs empowering to participants, though, they can also benefit community-based organizations and healthcare entities. Evidence-based programs can provide significant return on investment. And studies show that CDSMP in particular has shown reductions in emergency department visits, hospital admissions, resulted in significant potential savings per participant. And as you can see here, they did some studies on diabetes-focused programs specifically, and they were able to show a reduction in all-cause healthcare utilization, and direct cost savings were of $815 annually. So that's a really good savings. And then furthermore, evidence-based programs offer greater opportunity for community-based organizations to access varied funding sources. They allow for partnership development in the community, and they can bring community members to your agencies or facilities who might not otherwise participate in your programs, and thus build your constituencies. As I said earlier, many area agencies on aging, or we call them AAAs, across, and it's not the car thing. It's for our seniors and our disabled folks in the communities. Many across the country collaborate with community-based organizations to deliver these programs. Missouri's Association of Area Agencies on Aging received a federal grant in 2018 to build a statewide contractual network, which we call the MA4 network, to deliver all of these programs. 8 of Missouri's AAAs, including MARC, joined the MA4 network and collaborated statewide to fulfill the grant goals. Last week, MARC was awarded a new and even more ambitious grant as the lead entity of the MA4 network to continue building the infrastructure of the network and expand our reach and service provision significantly. In order to help meet our grant goals, MARC developed an integrated care network for the Kansas City region to streamline delivery of community-based support services to our participants, including, but not limited to, evidence-based programs. MARC currently covers the following counties. So most of you may know this if you're in our region, but we cover Cass County, Clay County, Jackson County, Platte County, and Ray County on the Missouri side. And then on the Kansas side, we serve Johnson, Leavenworth, Miami, and Wyandotte counties. So our network, our mission as a network is to build a sustainable, collaborative network of community-based organizations, providers, and payers to improve the efficient delivery of high-value community-based services, resulting in demonstrable improvements in health outcomes and reductions in healthcare costs. And this is just a visual representation of MARC's Regional Integrated Care Network. The green boxes that you see, those represent MARC's network partners. And then the peach colored boxes are their subcontractors. And then the blue boxes represent implementation sites. And then the little figures that you can see, those are our master trainers and where they're located. Before I joined MARC, I was a community health worker and transitions of care liaison with the Kansas City Quality Improvement Consortium. So Kim and I have been working together for several years now. K-Quick, as we call it, often partnered with the Kansas City Regional Arthritis Center. So I also had the opportunity to get to know Orvie Pruitt and become really familiar with the RAC network. So when I began coordinating MARC's evidence-based programs and focused on expanding our regional network, I turned first to Kim and Orvie, two of my longtime partners in crime. As fellow master trainers and co-facilitators for chronic disease self-management education, I knew that they could really help me get started. So I immediately enlisted Kim and her team to begin facilitating workshops and began collaborating with Orvie to build the network. I'll share a little bit more about the detail about that unique partnership later on in our presentation. I just wanted you guys to get a view of what the network kind of looks like at this point. So you may be wondering how your agency or organization can partner with MARC to provide evidence-based programs. Well, I'm going to tell you. MARC offers an ongoing, what we call rolling RFP or request for proposal, which can be found on our website under the heading RFP. I have included a link in the slide, as you can see. So we will include a copy, as Denise said, of this PowerPoint on the website after the conference concludes. So don't worry about writing down any URLs. There's a few more in here, so don't worry about that piece. You can always access it later. So the first step is for your agency to submit a bid to deliver integrated care network services for MARC. If the bid is accepted, then MARC will contract with your organization and begin to provide support. And how do we support our community-based organizations? We reimburse them for the cost of facilitator training, program supplies, and we also give a per completer rate depending on the number of facilitators that a community-based organization provides to implement a workshop. And then completer, just so you're aware, is defined by the program developers within the parameters of each EBP. So as we call them, evidence-based programs. So we don't control that. That's the developers that make those decisions. And then how do MARC and other AAAs determine which programs are eligible for the funding? The National Council on Aging provides guidance to assist us. NCOA's Center for Healthy Aging, the center, supports the expansion and sustainability of evidence-based programs by providing training, technical assistance, and helping professionals provide community-based health education opportunities for older adults, adults with disabilities, and their caregivers. The center houses the National Chronic Disease Self-Management Resource Center and the National Falls Prevention Resource Center. NCOA also provides a toolkit on evidence-based programming for seniors that you or your organization may find helpful. And there's a link here on that slide as well. And then this slide includes additional links to NCOA's guidance for specific topic areas. I'm not going to describe them. Again, you can look at the PowerPoint afterwards on the website, and you can link to those sites and see, what NCOA has to offer. It's very helpful. We'll also post several handouts that we hope will be beneficial, including fact sheets on specific programs, overview of programs facilitated by our panelists, and the current list that NCOA provides of evidence-based programs that are authorized for federal funding, in case you're looking for a program that you can get funding for. With that, I'm going to toss it over to this excellent panel and some of my favorite network partners, so they can briefly tell you about themselves, the organizations they're affiliated with, and the evidence-based programs their agencies offer. Kim, take it away.
All right, thank you, Tane. Again, my name is Kim Downs. I am the CEO of Kansas City Quality Improvement Consortium, And we are a community-based organization dedicated to improving health literacy through evidence-based programs. I'm a master trainer for SMRC and a leader for some of the other programs that we offer. You can see here on the slide. We offer the full suite from SMRC, Building Better Caregivers, chronic disease, chronic pain, diabetes. We also have the availability to do Tomando, which is the Spanish version of CDS-MP. We have a couple of different fall prevention programs, as well as the aging mastery programs. So we are a little unique in that we also offer monthly wellness checks at some of our senior housing facilities. That gives us the opportunity to build relationships with the residents and to promote the programs that we offer to them. So we feel really fortunate to be able to get into the community on a regular basis and provide resources and education to those folks.
Thank you, Kim. As Denise mentioned when she introduced us, Orvie Pruitt, one of our planned panelists, had a death in her family and was not able to participate today as a result. She's the coordinator of the Kansas City Regional Arthritis Center, located at St. Luke's Hospital on the Plaza. Orvie is an immensely important partner in our network, and I don't want you to miss out on the information that she planned to provide. So I'm going to give you a brief overview of the regional arthritis centers in her place. The regional arthritis centers were established by legislation to serve communities across the country. Missouri is unique in that we have 7 regional arthritis centers that are part of a statewide network run by the Missouri Department of Health and Senior Services Arthritis and Osteoporosis Program. It's quite a mouthful. We call it MAOP. MAOP coordinates with all of the RACs to provide coverage for every county in the state. And this slide just lists the RACs in Missouri. Our RACs are fantastic resources for evidence-based programs related to arthritis or other chronic pain conditions. If you need anybody to give you some information, some backup, some support, even sometimes some incentives or books and supplies. So they're a really great resource. As I mentioned earlier, the Kansas City Regional Arthritis Center is housed at St. Luke's Hospital on the Plaza, and the RAC currently offers virtual self-management or at-home self-directed toolkits with phone support for chronic disease, diabetes, and chronic pain. Orvie also manages the facilitation of Walk with Ease, and that's an arthritis foundation program that allows for self-guided or group participation. Due to the pandemic, these walking groups have convened virtually, and one silver lining is that it has been absolutely delightful to see tours of participants' neighborhoods. So they're participating in the class on their phones and they're walking around and showing their neighborhoods, which is really cool. Virtual leader training is offered for all programs listed. Victoria, can you share next?
Absolutely. Thanks, Tane, and a warm hello to everyone. My name is Victoria Jackson, and I am the Health and Wellness Coordinator with Liberty Parks and Rec. And Liberty Parks and Rec serves Liberty, Missouri, which includes a population of about 64,000 people when the populations of both the city proper and surrounding areas are combined. The mission of our organization is to create community connections, and we believe that providing the highest quality parks, programs, services, and facilities are essential to a prosperous and a healthy community. Our partnership with the Liberty Silver Center, which is actually housed on site here at the Liberty Community Center, led us into our relationship with the Mid-America Regional Council, who has supported facilitator trainings that have allowed us to dramatically expand the capacity of our community-based health and wellness programs. And we currently offer all of the programs that you see listed here, including the suite of self-management programs, the Aging Mastery Program, Walk with Ease, Active Living Every Day, Circle of Friends, Fit and Strong, and Silver Sneakers group exercise classes, and Aqua Arthritis.
Thanks, Victoria. Kathy, you're up.
Yes, I'm Kathy Armitage, the Active Lifestyle Program Director at the Platte County Community Center South, YMCA. And at the YMCA, we have evidence-based programs that meet our members' needs on every level, no matter how deconditioned or fit they may be. Our mission with these programs is to increase their fitness level, build confidence, increase balance, flexibility, coordination, strength, and help manage chronic pain, so that our members can age in place in their community homes.
Thanks, Kathy. So we're now going to delve into the nitty-gritty and share some of our experience and best practices to help you navigate some of the challenges that often arise when facilitating evidence-based programs. We'll focus on building collaborative relationships, tips and tricks for improving marketing and participant recruitment, as well as overcoming barriers that frequently arise. We'll then take some questions from all of you, so please do not hesitate to submit a question in the chat window. Since Orby could not be here, I'm going to start us off on this one to discuss and share a little bit about the unique partnership between MARC and the Kansas City Regional Arthritis Center. So collaboration is one of the primary pillars needed to facilitate effective programming in our communities. Community-based organizations have been offering health promotion and disease prevention education for many, many years. So there are facilitators spread throughout the region delivering the same or at least very similar programs. As I mentioned earlier, I reached out to Orby right away when MARC began to form our integrated care network, because I knew she was the coordinator of another statewide network and had always enjoyed working with her in the past. So since then, Orby has become one of my greatest mentors and is a true champion of collaboration. Orby and I luckily have the same mindset about collaboration. We quickly recognize that a united community presents, a united community presence builds stronger partnerships and programs. MARC and the Kansas City Regional Arthritis Center join forces on many, many levels to maximize our capacity as shown here. We train CDSME leaders together. We order our materials and our printing together for the greatest discounts. And then we promote all of our scheduled classes together and frequently co-facilitate. We also strategize on ways to expand programs to improve the quality of life for those we all serve and to streamline the process to provide cohesive and consistent support for leaders within both networks. Combining and coordinating our efforts has allowed both of our networks to partner with an expansive web of community-based organizations and smaller coalitions as well. So I'm going to pass it back to Victoria now, and she's going to share a little bit more about collaboration.
Thank you. So what you all see here on this slide is a visual representation of several organizations that collaborate with either MARC or the Regional Arthritis Center. Here at Liberty Parks and Rec, we are no stranger to collaborating with other organizations in our community. We actually are one of 4 community partners that form the Liberty Community Health Action Team. And this is a coalition that strives to create a community where healthy behaviors are the easy and preferred choice by making community improvements in key performance areas. We also work closely and collaboratively with the National Recreation and Park Association and have been awarded grants that supported evidence-based program instructor trainings, and a collaborative effort with the Liberty Hospital under the evidence-based physical activity pilot program. That includes a wonderful point of care referral process for patients of 7 Liberty Hospital clinics to our evidence-based program offerings. Additionally, we're also part of the Northland Living Well Collaborative. That is a coalition that pools resources and works to create a network of easily accessible evidence-based programs in the Kansas City, Missouri Northland area. I've already mentioned that we do have a pre-existing relationship with MARC, and our partnership is collaborative, and it has allowed us to develop a level of program sustainability that we did not have previously. MARC actually provides us with program materials and a per completer reimbursement, which actually allows us to cover our costs to offering these programs and allows us to keep our programs free for the community. And this has really been impactful for us because we know that in some instances, previously charging a registration fee for our programs created a barrier for interested participants that might have benefited from taking our programs. And our partnership with MARC has allowed us to completely eliminate registration fees as a barrier. So I really can't say enough about collaboration when it comes to evidence-based programs.
All right. I'm going to ask Kim actually to talk a little bit about what you do with the center, with your senior living facilities in terms of collaboration. And then you could go into more later, but just if you could just talk to us a little bit about the collaboration that you have with some of those senior living facilities, that'd be great.
Sure. Yeah, I work a lot with the activity directors at senior living facilities. Activity directors are always looking for activities to engage their residents, and they're really open to having these workshops. It gives them several weeks in a row where they've got something that engages their folks. I have a couple of places where the activity director does what she calls busy bucks. And so each participant that shows up gets busy bucks, and once a month she opens her general store and they can buy things at her general store with their busy bucks that they cannot buy with their SNAP card. So they can get their cleaning supplies and their personal hygiene supplies. And so it gets the residents in the door, and then it's up to me to engage them and keep them there. And that's where having a passion for the work really comes to play. That has been a very effective marketing tool, which I'll get into a little later.
I'm going to go ahead and move you to it since you're there.
All right. So as a community-based organization, it's our mission to help the community that we live and work in, and evidence-based programs are a great way to do that. As Victoria was saying, collaboration between organizations is crucial. We help each other not only by cross-promoting each other's programs, but by helping each other co-facilitate programs. Sometimes we don't have enough leaders in our own organization to cover what needs to be done. So we can always pick up the phone and find somebody to help us out on that, which is awesome. As far as outreach and marketing, social media is good. Most of us have a Facebook page, or some of us are on Instagram, different things like that. We have websites that we can market on. Newspaper ads or even newspaper articles, if you can get one written, that is easier than it sounds, especially if you're in a smaller community where there's a local paper. They love to do human interest stories. Same with TV, you can get an interview, and that's helpful. Tane and I actually did a radio talk show recently with a program graduate that wanted to share her insights that she gained from taking our workshop. And that was a lot of fun. It was right before the shutdown, so we were planning a second one, and that hasn't happened yet, but I'm looking forward to doing it again. Waiting list is another thing you can do. If you have the availability on your website, people can sign up for a class, and you can keep that list. Referrals from partners and healthcare providers, and word of mouth from past participants is really a great way to get it. We have several different ways that we can deliver these programs. Right now, in person is not an option, but hopefully we'll get back there soon. But we can deliver the programs over Zoom. We also have a teleconference phone program where we all get on the phone at the same time. It's a small group because without the video, it's a little difficult to keep people from talking over each other. But it is effective. And we also can use the mail and mail out toolkits for participants to learn at their own pace. And we just check in on one-on-one phone calls to give them direction or answer any questions that they might have. But that's more of a self-directed program, which works for a lot of folks as well. So we have many ways to reach out to our participants and get them the information that they need.
That's great. So like Kim said, we haven't started to convene in person, not all of us anyway, but I wanted to ask Victoria, since you're at the center, often are you doing any in-person activities? I know it's not necessarily the evidence-based programs that you do with MARC, but I assume maybe some of the activities at your center are in person.
Absolutely. We have begun to bring some of those in-person products back. They do look a little bit differently. Maximum capacities are limited based on the space that we have to accommodate for social distancing. And we are taking all the precautions we can and following closely any guidance that is provided to us by the Clay County Public Health Center. So we're beginning to, it's a slow process. Our senior center opened this week. So the Silver Center opened, and we got permission from the Clay County Public Health Center to go ahead and open. And so we have some small groups, and we are excited about that. So we're getting there slowly but surely, and in the most safe way possible, for sure.
Yeah. Yeah. And Kathy, before I have you talk a little bit more about recruiting participants, how are you handling that in person? Because I just figure that's probably something a lot of people are interested in right now.
Yeah, thanks, Tane. Yeah, I did Victoria's. We're in the same thing. We're starting up our in-person classes and groups for my active older adults here. We are once again following all the CDC guidelines and Platte County guidelines upon us. But yes, we have been running and they're coming back in droves, our programs, in-person programs.
That's good to hear. I know you were talking when we were practicing one of the days about some of the water activities. That's got a big pull, I imagine, right now, because it seems a little safer.
Yeah, we still run our arthritis classes in the water, and yes, you can maintain social distancing in the pool, and our members, a lot of them will wear face shields when they're participating in the water classes, not the mask, but the face shields. And Sue Ellen has had just about everybody come back to the water class and then some.
Okay. That's really interesting. Okay, so now I'm gonna I want us to safely say that recruiting, well, let me just put it this way. Recruiting participants can be tough. So that's one of the challenges that face us as facilitators. And while recruitment often goes hand in hand with marketing, like Kim was talking about, there are some additional strategies for targeted recruitment and referral that are helpful. So Kathy, could you describe the unique opportunities for recruitment that the YMCA presents?
Yeah, some really great recruitment tools is one, a YMCA membership gets you into any YMCA in the greater Kansas City. So we have program participants that will go from Y to Y. But most of our active older adult memberships comes through the YMCA insurance companies, like the VS Silver Sneakers, programs like that. We also have membership discounts with Clay County and Platte County Senior Funds, offers a discounts to our active older adults. And then one of the ways the YMCA, we get all our staff engaged in our members' first connection and engage in their fitness journey. So our welcome center is our frontline staff. And so when we have active older adults come in, we talk about where they want to begin. So we automatically connect them with what we call a coaching connection. And then that is a free coaching connection with any member at any time. And it's 4 visits. And that's when we sit down with our members and we talk about their fitness journey, their fitness goals, which would be the best class to connect them in. Like I said before, all our evidence-based classes and our other classes try to meet our members on the level that they are in and then help navigate them through that fitness journey. And one of the most important things is if we can get them to connect in the first three visits, we can keep them engaged in all the programs that we can offer. and to them. And like I said, that first connection and fitting them in the proper class, whether it be a water class, a land class, maybe they need a personal trainer with some individual training, or maybe they need extra attention on what is the best cardio equipment fit for them. So that's what we try to do here at our facilities with all our members. And then once they have mastered or have improved and feel like they want to move on to a difficult class or a little bit harder, we help navigate that. So we really never want to keep our active older adults in this perceived box that they're an old senior that they can't do anything. We have had seniors come in that were so deconditioned in the beginning of their fitness journey, and then a year later they are already processing through some classes, active together out of enhanced fitness, which is an evidence-based, going to a little bit harder and tougher class. So the key to keep our participants and keeping them engaged and recruiting is definitely an all staff effort here at the YMCA, from frontline staff to our healthy living staff to our director staff, even to our lifeguards. We all take a role in keeping our members engaged in their fitness journey.
Yeah, that's really neat. Now that's something that we don't all have, that's for sure. And I'm throwing little loops at our panelists today because we practiced all of this, but now I'm throwing extra questions at them, but hopefully they don't mind. Victoria, I just wanted to know, is the Liberty Community Center kind of similar in that you kind of get a whole wraparound, like the entire agency hugs you and puts you through the process?
It absolutely is. A lot of the things that Kathy mentioned, we do as well here. We do offer silver sneakers classes, and we do offer memberships to those who are silver sneakers members, Renew, Active, Silver, and Fit. And we have a couple more insurance companies that we support here and are able to offer memberships and services. And so with our evidence-based programs, that is a great way. We usually, scheduling wise, will line up our workshops in a way that is semi-progressive. So maybe we start with a workshop that focuses on behavioral change first for those people who maybe need to get going in the right direction again, or are just now embarking on this journey of health and wellness. And we will progress them into Walk with Ease next, which is a progressive walking program, and so on and so forth. And we do have aqua arthritis classes and those low impact classes. We also house personal trainers on site. So we have all the resources in-house, and we find what's best for each unique member that visits our facility. And it's wonderful. We have seen that our older adults that are most successful are those who go through multiple programs that benefit from multiple service lines that we offer. It works, and they're really pleased on the other side. So it's a beautiful process. It's so fun to watch, but that's, it looks very similar here as well.
Yeah, that's really cool. Yeah, most of us, I don't know, don't have that access. So, we have a lot more limited access to an entire agency that is focused on these health promotion programs. And actually, to be completely honest, the whole reason why, when I was building our network, I immediately thought, I've got to get in touch with people at the Y and community centers, so in Parks and Rec. So I knew just from my lay life that the community centers, Parks and Rec, and YMCA's provided health promotion programs. So it seemed like a perfect fit. And so I started approaching those agencies, and all of our panelists are in our network at this point. So like I said, the rest of us don't have access to such a neat milieu. So Kim, could you share a little bit of additional strategies for recruiting participants?
Sure. It is a little more difficult when you're kind of out there on your own, but it can be challenging in the beginning. But once you get it going, it really just kind of feeds on itself. So One way to do that is to contact champions in the community. So again, the activity coordinators and directors at senior housing and senior centers are both a great resource. Religious leaders. I have taught several workshops in churches. Doctors' offices can also be helpful. I'm working with a diabetes educator right now to refer her newly diagnosed diabetes patients to the DMSMP program. So there are pilot programs out there in collaboration with different healthcare entities that are interested in doing these programs. There's a few of those going on right now. Again, cross promotion between programs is a no-brainer. I personally have never taught a workshop where they didn't ask me to come back and provide another program. As I said earlier, directors are always looking for ways to engage their people. So that's a great way to do that. MARC and MSN referrals via the healthcare entities, as well as clinics whose patients, my goodness, excuse me, can benefit from evidence-based programs. And again, I can't say it enough, but word of mouth. You know, I have had participants at the community center take a class and say, oh gosh, can you bring this to where I live? Or would you teach this at my church? And you know, being a small community-based organization, I can take it anywhere. So, and I am always more than happy to do that. So word of mouth definitely will build your brand and get you out to more folks.
Yeah, she's not kidding. She will do that. Like I have her help everybody. It's, you know, I even had somebody in St. Louis needing some help recently. So I'm like, hey, Kim, can you help this team out? So Kim is very versatile and willing and available, and is a great resource for our network. I can't lie though, aside from tackling the basics of assembling a team, marketing your programs, and recruiting participants, you will encounter more obstacles and speed bumps along the way. So Victoria happens to be one of our savviest problem-solving gurus in the network. So I'm going to toss it to her again. And Victoria, can you share some of your insights?
Absolutely. So as Tane mentioned, inevitably, there will be barriers along the way that come up, and these look very different depending on your organization. But really the good news is that with some planning, collaboration, so on and so forth, these evidence that they can be addressed. You'll hear me reference material that we have already gone over up to this point, and that's because they apply here. We can utilize some marketing strategies and collaborative efforts to overcome barriers associated with program implementation. Starting with spatial capacity, here in Liberty, we have a very well utilized, active, and thriving community center, and we love that. However, it is something that can make finding space to hold programs at our facility a challenge at times. So we have successfully addressed this barrier by hosting workshops at other community-based facilities and organizations like libraries, places of worship, event spaces, and more. And we found that due to the nature and community impact of evidence-based programs, after a short discussion and description of what these programs accomplish and how they impact the health of the community, many of these organizations actually allow us to utilize their space free of charge, which is nice. And then I'm going to go ahead and pause for a second. Should I pull up? I think we lost Tane. Should I pull up the PowerPoint here? Or does Carmelia have it, or Denise?
Give me a moment.
Go ahead, Victoria, if you've got it. I think that makes sense.
All right, let's see if I can pull it up here really quickly.
our participants have done a great job of helping to help others find programs in their communities. So thank you and kudos to all of you for contributing to that.
Yeah. All right. I think
are you ready?
I think I have it here. Let's give it a try. Can you all see? I think I'll have to flip forward a little bit, maybe. All right. How's that look? Okay. Good. Okay. All right. So moving on from spatial capacity. Uh-oh. Okay. All right, so another additional barrier can absolutely be getting the word out. We found that programs are most successful for us when program advertising and information is made available in places where the target population are most likely to see it. And this at times can require thinking outside the box. It's not always easy. So every community is a little bit different. It's important to think about where ideal participants for your programs are going to be. Is that a community center? Is it a senior center? Maybe a local area agency on aging? Or are you more likely to reach your ideal participants by way of a newspaper article or a press release, a local TV or radio station, a social media outlet, emailing lists, and so on? Again, those are several marketing strategies and outreach strategies that we talked about a little bit earlier. So be creative and figure out what works well for you in getting the word out. Next is participant investment. Getting participants invested in a program can sometimes be a barrier. However, I will say that participant investment is the most important component in the overall success of any given program. So one way to foster that participant investment is through leader enthusiasm, as well as participant engagement and support, which again is facilitated by those who are leading each individual program. So we found that leader enthusiasm has a really significant impact on how many participants ultimately become program completers. So I really always encourage that you recruit leaders that have a skill set and are passionate and that you believe can make your programs a success. Moving on, buy-in from leadership can be a challenge at times as well. Traditionally, you probably wouldn't think of a Parks and Rec organization as a leader in community health, but that notion is changing. And in fact, the National Recreation and Park Association has set 3 pillars as chief priorities. And one of those pillars is health and wellness. Within that health and wellness pillar, Parks and Rec professionals are recognized as being leaders in improving and enhancing the health and wellness of their respective communities by being actively engaged in reducing obesity, physical inactivity, poor nutrition, and more. And these are priorities that have shaped our mission here at our organization at Liberty Parks and Rec, and our leadership is included in that. So we have a mission that supports community health impact. And having the leadership at our organization and in our community believe in and support our efforts to impact the health of our community has been a vital support system that has allowed us to make our community health and wellness programs a success. So that's why we're addressing buy-in from leadership here. It is very important in your endeavors to get support from leaders, not only at your organization, but in your community. Familiarize yourself with the evidence-based programs you're looking to offer and their benefits, and then discuss the programs with the leadership at your organization and in your community. Most of these programs have a promo or a pitch session, even a 0 session that can be utilized. And more times than not, once leaders understand the incredible impact of these programs, they will offer their support wherever possible. So I really want to stress the importance of having leaders buy in to the value of evidence-based programs and the research that supports them, because they do work. Transportation may also be a barrier for participants, and if transportation is a barrier, you can enlist in the help of public transportation services in your area. Here in Liberty, we utilize the Liberty Access Bus, and MARC also has transportation services. The county has transportation options as well, and KC Taxi is available if a participant lives near a bus route. And moving on, access to resources. This is a big one. And this can seem hard to come by sometimes, to say the least. It seems like resources are always scarce. So start by partnering with a community-based organization, with MARC or a local area agency on aging. And they can provide training opportunities and program materials for pre-approved evidence-based programs. I talked about collaborating a little bit earlier in this presentation, and I'm going to mention it here again. It won't be the last time I mention it either, but partnering with other organizations can allow for a pooling of resources for things like incentives, materials, staff, and facilitators, as Kim mentioned earlier. Community collaboration is really one of the best ways to access some of the resources needed to begin offering evidence-based programs or improve programs that you are already offering, because I saw from the poll a lot of those listening in and participating today actually are thinking about offering programs or already do offer them or plan to offer them in the future. Collaboration can improve the programs you're already offering. I know I touched on this component earlier as well, but there are grant opportunities out there. They do exist, and they can provide resources to support evidence-based programming. So just do a little bit of research, see what is out there and available to you. Technology as a barrier is also not uncommon, but I do want to say, don't assume digital literacy is a barrier in your community. You might be surprised at the capacity that adults and older adults in our communities have to learn new technology. And building a participant's self-efficacy with this can be as simple as just hosting a 0 session to troubleshoot technology. And this is something that we really have learned a lot about over the past year with COVID-19 and that shift from in-person programs to virtual programs. However, with that being said, some in our community are homebound and or might have a lack of internet service or video phone conferencing skills. This can be addressed by utilizing remote implementation options that are available for the suite of self-management programs and others like Fit and Strong and Active Living Every Day that also boast a remote implementation option. And confidentiality. This can also be a concern for participants and or host organizations and might present a barrier. Participants often, they end up sharing personal information at one point or another during a workshop. It is the nature of the group setting of a workshop. And so that does come up, and registration paperwork that the participants complete prior to the first session of a program does collect some sensitive information. So during the first session of a workshop, when discussing program guidelines and expectations, we always explain to participants how their information will be used and protected. And we remind each individual participant to respect each other's confidentiality. To add to this, all of the programs offered under MARC's network are HIPAA compliant, and the staff that handles sensitive documents has successfully completed HIPAA training. But for an additional layer of added security for participants, there are still some registration paperwork fields that are optional. So a participant can choose not to fill out some of the portions of the form if they feel uncomfortable. So if I could summarize overcoming barriers and conclude with one common theme for having success with addressing barriers in evidence-based program implementation, it would be that we are all in this together, and we're better together, and we can have the most impact if we work together. Collaboration and community partnerships are really a sure key for success. So with that being said, I will pass things back to Tane if we have her.
I'm back. I don't know what happened. I'm so glad Carmelia had the slide deck and could pop that up for you guys. Yeah, it's weird. It's been actually quite a while since I've had any internet connection problems, but of course it would happen right in the middle of the presentation. So basically what we want to do now is just take some time to answer your questions. So to the best of our ability, Denise, bring it on.
Okay, well, it's been really good because a few things have been answered by other participants, but there was a question about a little bit ago about what is your series of progression? This particular person wants to do something similar.
So we had both Victoria and Kathy talked about a series of progression. Actually, so did Kim, because these classes can feed upon each other. But Kathy, could you, wait, I don't see her video. Is Kathy? There you are.
Kathy's
I see you now.
Yeah.
I'm here.
Kathy, can you talk a little bit, you went into pretty good detail, but if you could kind of explain how you go from, like Victoria did, like from a beginner's class to a more intense class.
So when I meet with an active older or a deconditioned older adult coming in for the first time, I get a pretty good feel on whether they would fit best in perhaps our arthritis prevention land exercise, which could be done in a seated or is done in a seated position, or is their arthritis really, really bad? And then I could put them into the water arthritis class. We have the enhanced fitness class that can be done either seated or standing, depending if they're a little bit stronger and have a little bit more enthusiasm to really jump into the pan. I also highly recommend that while my active older adults are choosing these classes, that we also run the Matter of Balance class, because we really want to focus on their fear of falling, what puts them at risk for falling, have them identify how to reduce their risk for falling at home, in the community, so that they can still move about with some confidence with that. So the progression really is a one-on-one conversation and really a deep dive in with what your participants is comfortable with doing, because not everybody is a water person. And do I want to start them out with, the land arthritis class? Do I want to start them with Tai Chi if they really, really want to be into the mindfulness and thinking about how to be really methodical in the way that they move? So that's kind of sort of the progression that we use here at the Y. And I think it helps them to be successful, to move throughout, like I said, that fitness journey outside that box. Because I never, ever, ever want them to stay in the box if they are capable and able to do more difficult exercises and all of that. So I want them to be able to do their activities of daily living at home, comfortable and age in place. And I think those type of progression classes gives them that confidence in doing that.
Yeah, I would absolutely agree. Are there any other questions?
There are just a couple others. One comment that churches and libraries have been great partners for hosting and offering space if you're looking for a place to hold one of these evidence-based programs. Also, I know Victoria kind of touched on this about barriers for evidence-based programs for homebound folks. One was mentioned by Haley about a book club, but are there, maybe you could talk a little bit more in depth about other programs, that really work well for someone homebound.
Yeah,
Okay.
I would say that that was one of the silver linings that came about with the pandemic, is that we did not have a lot of virtual capacity before this. But because of the pandemic, everybody went into action nationally to revise and reformat these classes so that they could be done in a virtual format. And so I think it's been a really great opportunity to reach our homebound constituents. MARC actually serves quite a large constituency of homebound folks, and we've never been able to get them into workshops before. So I'm really excited about that. And then, you know, when they can't use, if they don't have internet access, or they're having, you know, internet connection problems like me, then, you know, maybe they could do the teleconference version of the classes. And most of them, they have that available too, which is a nice way to do it. Denise, you could probably even tell us a little bit on the AMP side for Aging Mastery. I know that you're able to call in, or you can do the video. Is that correct?
That is correct. And they have kind of a toolkit too, kind of specially designed for people if they're homebound, you know, that they can kind of do it as kind of a self-paced study, which is kind of neat. Yeah. Also, the Walk with Ease program lends itself really well to do kind of a self-study program. Kansas has adopted a version of that from Oregon, where they meet just once a week virtually, but then the other 2 times a week they walk on their own. So it's really a successful adaptation, if you will, of that program. So I think, you know, looking at the list, I don't know that there's many that couldn't be adapted or changed to work with a homebound person. So.
Yeah, I totally agree. I do think, I mean, there may be some programs that just haven't done that adaptation yet, and we do have to follow fidelity and the program developers scripts. Yep. and manuals, but they jumped on it. I mean, like they got all into it. We spent the first few months of the pandemic brainstorming and meeting on a national level, coming up with a lot of different possibles and some guidelines. MARC convened with our MA4 network a virtual work group, and actually most of, you know, I know Victoria was on that group, and I know Kim was on that group, and we created a checklist to help all of our leaders in the network kind of be able to follow like the checklist, because, you know, it's not just our participants who weren't very familiar with all of this equipment and all of these modes of operation. So we had to learn about Zoom as well. Some of us didn't have that experience before. And so that's been a real challenge and interesting journey. I know recently Kim and Victoria helped train some leaders who had some challenges with the technology aspects. So we've kind of incorporated, even in our leader trainings, some technology training as well, to make sure that they're able to help the participants to participate in Zoom or WebEx, or you can use any virtual format, as long as you make sure you've got it HIPAA compliant and are restricting access to the class so that strangers aren't popping in. You should be okay. I did notice a comment in the chat from Tina Urich from Clayton County Senior Services, and absolutely thank you for saying that. Please help promote our classes. We all have trouble, you know, like we said, getting enough participants to be in a class in order to maintain the fidelity of the workshops. They have some minimums they want you to keep at. So if we can all help each other, help keep people on this journey, like Kathy and Victoria talked about that progression. Well, there's no reason why they can't progress from one of my workshops to one of your workshops that you're holding out there. So cross promotion is just really important. Any other questions that you saw, Denise?
Just a couple comments. A couple people suggested PCs for people as a way to address the technology barrier. We also had someone mention that the Kansas City Metro library systems also can help support EBPs by mailing out books and other materials to help support that. So I think that's good to know. That someone suggested TV as a way. Go ahead, Tane.
I was saying you could actually go to a library and get on the computer and participate there even.
Exactly.
They let us hold programs at their facilities for free. So there's no reason why they would let participants do the same.
Hey, Tane.
Yeah, that's a great idea.
Yeah.
Tane, one of the things I want to suggest out to the audience, I have ongoing computer class programs, but when I first started it, my gentleman realized that maybe I need to teach how to use my phone because they may be using their phone, or how to, and then he had a whole nother one on how to use the iPad. And then he had one on how to use your Apple computer and all of that. So having ongoing programs and knowing what devices that they're using can help build more of that that technology and reduce that barrier. If your workplace can have that opportunity to do that, to find somebody that's willing to commit to the different sources of technology that our seniors have to help them get involved a little bit better.
Yeah.
There was also another suggestion that came in that one of their age-friendly communities partnered with their closed circuit TV production group to create their own how-to videos to help people learn how to use Zoom and computer skills. But that's also a way you could potentially do one of our evidence-based programs too. I know there's several age-friendly communities in our county that has that option. So just tapping into presenting it in a different way. So
absolutely. So collaboration again. If we all we put our heads together, we can solve these problems. Victoria happens to be kind of our tech guru in the network, and she did a training for a lot of people to teach them how to use all the technology. So now we're probably going to have her do a training module for the MA4 network statewide, and we'll help her. But she's just really good at it. So and that could be released and given to anybody that could just jump on our learning management system and learn a little bit about it. So it's kind of cool. I think we have that capacity for sure. And then any other comments or questions before I have you close out, or are we at that point?
We're getting close. I think a lot of talk kind of about what can be offered, and definitely that networking piece is truly one that is so important. Collaboration with others. There's also discussion about people offering on the Kansas side, stay strong, stay healthy. And then,
I wanted to ask you about that, Denise, another time, but. So
yeah, another time. It's a,
do that one?
Yeah, that's an extension program, but it also is evidence-based as well. So, and it's from Missouri Extension, and Kansas adopted that particular program. So
yeah. I still need to get you in our network so that I can help support your program.
Yeah, definitely. So
we actually have, we were offering that program as well as many others from the extension offices to some of our private health insurance contracts and entities that are referring clients to us. So I'm pretty excited about the possibilities, and would love to get you involved in some of that. So there's a lot of stuff coming down the pike for everybody out there that isn't aware that MARC's Managed Services Network is quickly bringing on partners that will be giving us referrals for classes. So hopefully that'll help with our participant rates as well.
Yep. Well, I think we are kind of at that point of time where I want to just say thank you, Tane, Kathy, Kim, Victoria, and of course, Orvie. We thank you in spirit. You've provided definitely a comprehensive look at the value of evidence-based programs and some ideas for several programs for our audience's consideration. So be sure and look for an email this afternoon with a link to our participant evaluation for today's 2 workshops. And we look forward to seeing you, of course, tomorrow for our final day of Age Positive. We hope you'll hang with us a little bit longer as we have door prizes from several of our donated sponsors and also our conference partners. So I am going to turn the mic over to Cindy T. Berry.